hello everyone. It's Monday, December the 7th. You know, if we think about December the 7th, what an incredible day. It's when we were attacked at Pearl Harbor, and it's a day that will live with us forever and ever and ever. Before I get into all this, I want to tell you just something that just happened just a few minutes ago. But as I was on the way into the Capitol, there's a group of young ladies and their coaches or teachers that are with them. And these young ladies are from Oak Hill High School. And they're cheerleading superstars. They've qualified for the state tournament. And the state tournament, I think, was scheduled for this Saturday. And we had to move it. And we have to move it because we just can't possibly stand a gathering of people, a significant gathering of people that would come together, and just absolutely we know what it will do. It will absolutely compound a problem that is already just devastating us all over the place. You know, but when I stopped and I was talking to these young ladies and their coach or teachers, they all had their mask on. They're not only beautiful athletic superstars at their schools, and I'm sure they're all good students, but they were so mannerly and so caring about so many different aspects. The aspect of, you know, just the fact that they know we've got a catastrophe on our hands all across the land. You know, for all those that have participated in sports and got knocked out because of things that came up, you know, whether it was, you know, incredible volleyball teams that, you know, that had to get knocked out from the standpoint of the way the color maps changed and everything, or it was football teams along the way, or it was soccer teams, or it was a cheerleading team that was, I think at Tug Valley, was a 2-time state champion. To all these kids and everything, and their coaches and all the people and their parents that go in and put all these licks in, I feel their pain, and I hate it like crazy. And this pandemic and all that's going on makes me just sick. Now, with all of that, we all know we've got to do anything and everything we can. We're trying to make it as fair as we can possibly make it in every way. Naturally, along the way, there's going to be people that become casualties, and it's not good. I'm a coach too, remember that. Remember that my basketball team was, I don't know, maybe 22-3 or something like that on the season last year. We were getting ready to play that night in the state tournament. And a lot of kids, and our team was already here. We were staying here and practicing. We'd practiced here, and we were ready to go. Playing a team that we had beaten by 25 in the regular season to go to the Final Four with a real shot to win. And we pulled the plug on everything. We had to. We had to. So I know how much these kids give and how important it is to them in every way. And I really want to say that you talk about a class bunch of kids and a class coach and everything, the way they stood there and they talked with me and they really understood. And I want them to know, and every kid in this state and their parents, their coaches, all the administrators, the teachers, anybody and everybody, I'll promise you with all my soul, I will do everything I possibly can to try to see that they will have their day or their days in state tournament competition, you know, and everything. These people qualified and everything, and in this situation, we had the ability to move. And then there's a question that came up, which is a very legitimate question. We've got to some way be able to keep these kids in shape and everything. Well, right now, we can't do that. because right now is too dangerous. But when we bring them back, and hopefully we'll be able to bring them back real soon, we'll give them time to get back in their routines and get back in their conditioning and get back sharp again and ready to go. We have to move. We only have two choices. We cannot all come together right now. We cannot have a midget football tournament and everything where we have 20 to 50 teams like was about to happen in Beckley. We can't do that right now. And we can't do this right now either. I hate it, but we will try with all in us to do it and do it later. But we have two decisions. One is just cancel, period. Or two is extend. And in this situation, we had the ability to extend. And so that's what we're doing. But I want to thank them. I want to thank them from the bottom of my heart. You talk about a bunch of kids that absolutely have their act together. I am telling you, you should be very, very proud, Coach. And I know you are, and I'm proud of you and proud of these kids. Boy, they were just absolutely just great. That's all there is to it. So to the Oak Hill Red Devils, you got one bunch of superstars for sure that are your cheering team. So I hope we'll be able to see them, and we'll be able to see them soon, and the sooner the better, and we'll surely try to do it as quickly after January the 11th as we can, provided that we can do it then too. So nevertheless, getting back to the terribly, terribly serious stuff at hand, we've got 42 additional deaths that have happened in West Virginia since last Friday. The total number of deaths now in West Virginia is 841. Now, before I read through all these, and I will in just a second, I want to just tell you this and just think about it. Now, these numbers were as of probably Friday numbers. Our Friday number was 799. Think about this. The state of Kentucky, they've lost 2,014 people. This is probably as of Friday. We were at 799. In Maryland, they've lost 4,790 people. In Virginia, 4,160 people. We're at 799, now remember that. In Ohio, 6,753 people. In Pennsylvania, 11,021 people. And just think, that's all the states that border us. The closest state to us is Kentucky with 2,014. And at that time, we were at 799. I'm sure they've lost more people now. The next closest state to us is Virginia or Maryland, and they're in the mid-4,000s. That's why I keep telling you, West Virginia, you have done amazingly good. But the number of deaths is escalating in our state now with leaps and bounds. It's doing it all across our country, but it's surely doing it in West Virginia. Think about those out there that said, we want to be South Dakota. Well, South Dakota has half the number of people that West Virginia has. Half. And they're spread out all over the place. Half the people that West Virginia has. When we were at 799, South Dakota was at 1,064. So in other words, South Dakota had 30% more deaths than half the population. I don't want any part of being South Dakota. I got 42 people to read to you, and I'll go as quickly as I can, but at the same time, please, every single one I read, please acknowledge and keep them in your thoughts and prayers. The 800th death, a 67-year-old male from Tyler County. The 801st death, a 73-year-old male from Cabell County. The 802nd death, an 85-year-old female from Putnam County. The 803rd death, a 62-year-old female from Kanawha County. The 804th death, a 65-year-old male from Mercer County. The The 805th death, an 85-year-old female from Kanawha County. The 806th death, a 79-year-old male from Mercer County. The 807th death, a 69-year-old female from Mineral County. The 808th death, a 68-year-old male from Berkeley County. The 809th death, an 84-year-old male from Barber County. The 810th death, a 54-year-old male from Fayette County. The 811th death, a 36-year-old male from Mingo County. The 812th death, a 51-year-old male from Kanawha County. The 813th death, a 76-year-old male from Mineral County. The 814th death, a 93-year-old female from Mineral County. The 815th death, a 73-year-old female from Berkeley County. The 816th death, an 88-year-old female from Putnam County. The 817th death, a 94-year-old female from Kanawha County. The 818th death, a 74-year-old female from Fayette County. The 819th death, a 76-year-old male from Fayette County. The 820th death, an 84-year-old male from Kanawha County. The 821st death, a 75-year-old male from Kanawha County. The 822nd death, an 80-year-old male from Ohio County. The 823rd death, an 85-year-old female from Putnam County. The 824th death, a 61-year-old male from Mineral County. The 825th death, an 84-year-old male from Mineral County. The 826th death, an 82-year-old female from Preston County. The 827th death, an 83-year-old female from Preston County. The 828th death, a 47-year-old male from Logan County. The 829th death, a 63-year-old female from Logan County. The 830th death, a 67-year-old female from Wood County. The 831st death, an 82-year-old male from Wood County. The 832nd death, a 91-year-old male from Mineral County. The 833rd death, an 80-year-old male from Fayette County. The 834th death, a 94-year-old male from Preston County. The 835th death, a 93-year-old male from Mineral County. The 836th death, a 71-year-old male from Berkeley County. The 837th death, a 95-year-old male from Hancock County. The 838th death, an 81-year-old male from Ohio County. The 839th death, a 91-year-old female from Roane County. The 840th death, an 89-year-old male from Kanawha County. And our 841st death, an 87-year-old female from Kanawha County. Very, very unfortunately, it takes a little while to go through this. And I wish and hope to God above that these numbers will go way, way, way down. In fact, I hope and pray there'll be none. But the least that I can do, the least that you can do that are watching this, is be patient and be respectful as these people are read. They're great West Virginians. We've lost 841 of them now. Please keep them in your prayers. We had 1,131 new positive cases in the last 24 hours. Our daily positivity rate is 7.24%. Our cumulative positive rate is at 3.88. Our active cases is a little above 19,000, and our recovered is a little above 35,000. We have 610 patients hospitalized now and 176 in the ICU units. I think those are down just a teeny bit. I'm not positive of that, but I think so. Over the weekend, we tested 46,644 West Virginians. The testing is really, really helping us, but it's not enough. On Friday, December the 4th, was the highest one-day testing total ever in the state of West Virginia. We tested 21,719 people. Our reproduction RT number is the 15th best in the country. So our transmission number is the 15th best in the whole country. It's at 1.04. We got 14 red counties and 17 orange counties. There's no point in reading through all of them. If you'll add that up real quickly, that's 31 out of our 55 counties. 60%, or just short of 60%, of our entire state is red or orange. Now, if 60% of our state is red or orange, all across this land in America, if we're the 15th best in the country, we're getting an onslaught from every direction known to man. We still can't identify through our epidemiologists and our people and our medical team and everything, we can't identify for sure that makes me comfortable with shutting down businesses, because I truly in my heart believe, other than a wholesale shutdown, we cannot show where tracing or whatever it may be, the sourcing, we can't show that anything that we do is going to make any substantial difference other than wearing your mask. Now look, I could go on and on and on. I could beat the drum until I'm sick as I can, but at the end of the day, if you don't believe that we ought to be wearing our mask, then I don't know what I could possibly say. What I could possibly say. We got to turn this thing around. And absolutely with all in us, the only thing we can do at this moment is wear those masks. Now you've heard me and heard me and heard me. And you're going to have legislatures that are, playing to the crowd of, a few, a very, very vocal minority, a very, very small amount. And they're going to be standing up here in just a little over a month, and they're going to be screaming and hollering, that we ought to be doing this and we ought to do that, and we ought to listen, we ought to be respectful to everybody. But I'm telling you just as well as I know my name, every single person across this land, from the medical teams and everything, believe that the least we can do is wear your mask. Nobody, no part or being of Jim Justice wants to shut stuff down. I want to go to school. I want us to be able to have church. I want us to look at, if you're an elderly person and everything, to look at, getting your church services somewhere else at this point in time. I want us to stay open in every way, but you got to help me. You got to help me in wearing those masks. I caution everybody again, if you're 65 or older and you've got all kinds of health issues and everything else, you ought not be out, or you ought to be out as very little as you can possibly be. From the standpoint, over the weekend, we were notified that in Marshall County they had reached a situation and they had reached out to the National Guard as a preventative measure and everything for our refrigerated trailer to provide assistance to the county coroner. I've said enough about face coverings. I've said it until I'm blue-green. As far as the vaccine update, we submitted in the initial vaccine order to CDC last Friday. There will be 16,575 doses of Pfizer that will come in. They'll come in almost right at the end of this week or the first day of next week. This is 16,575 doses. This is not 16,575 that will get the shot and then automatically, there's enough to do 2 shots in this. There's enough to do 1 shot in this. But and please understand this, we don't need to get confused about this. If you get the first shot, the federal government has guaranteed us that you will be getting the second shot. You know, we have 60,000 vaccinations that we have been chosen for in phase 1, and we know that supply will continually increase every single week as we go forward. You know, there was someone that wrote or said something, you know, about my comment about in my hope, and, you know, please tell me somebody out there that can speak of this pandemic with certainties on anything. None of us can. We have to continue to adjust as we go forward. I am very, very, very hopeful in the state of West Virginia that this is not going to drag out until the middle of the summer, you know, to where we can provide at that time vaccinations to everybody. You know, I am very, very hopeful if we continue to push like crazy and this thing continues to ramp up, within the next 2 months, by March the 15th, I am very hopeful that we will be in a situation at that point in time to be almost or there at being able to vaccinate anybody that wants to get the vaccine. Now, I don't know that that will be a guaranteed possibility. I've never said to you, I guarantee you that's going to be that day. But in all honesty, you know, if you don't try or you don't believe it in your heart, it'll never happen. It'll never happen on anything. There's really no point in going through so many other aspects of the vaccine. The vaccine is really simple. On Pfizer, you get the vaccine, 21 days later, you get it again. Moderna, you get the vaccine, 28 days later, you get it again. You cannot commingle the two. You cannot take one Pfizer and one Moderna. You know, you have to follow that protocol. Absolutely, from the standpoint of it giving you COVID, the vaccine, and you getting COVID from it, no way. At least we've been told no way, you know, and I'm only passing on information there. You know, from the standpoint of how safe is the vaccine, you know, there are a few minor side effects, but the vaccine has been proven out by the FDA and CDC and all these people, and they're blessing it with rave reviews as far as its efficiency or, you know, levels or how effective it is. It's at 95%. Couldn't be better. From the standpoint of smallpox or measles, it's about the same thing. How long will it last? Nobody knows. Nobody knows if this is going to last for 3 months or 3 years or 3 decades. Nobody knows yet and everything. But every indicator about this is take the vaccine. Take the vaccine. It breaks the chain. And again, until you and the people who live in West Virginia are vaccinated, the absolute best defense that we have, again, is wearing our mask and the social distancing and doing everything we possibly can. Think about those little cheerleaders out there and how beautiful and absolutely how precious they are in our lives and everything. And if we'll wear a mask, we'll get to this vaccine. You know, you'll have a lot of happy young people that are in our schools and able to play sports and compete, and our lives come more and more close to normal as we can possibly make it. You know, we encourage people to get testing after the holidays that they've been through with Thanksgiving. Our free testing map's up. Our drive-through pharmacy testing's up. The Saturday education map came out. We had 14 red counties, 13 orange counties, 9 gold counties. That's all up. You know, we have only 22 outbreaks in our schools right now and 96 confirmed cases. That continues to be really good, and that's up as well. Our long-term care facilities, we have 117 outbreaks, and our long-term care facilities really is pretty good. You know, our Our West Virginia churches, we have 17 outbreaks in 13 counties. I always want to read these counties because this is really important for the folks out there thinking about going to church or not going to church, and that is Berkeley, Braxton, Cabell, Fayette, Harrison, Jackson, Marion, Mineral, Mingo, Nicholas, Raleigh, Taylor, and Wyoming counties are where the outbreaks are right now. In corrections, this number bounces all over the place and everything, but now we're going back up. We have 280 inmate cases statewide. 205 of those are at the Northern Regional Jail and the Northern Correctional Facility, which share a building, and we've seen it. We've seen it over and over and over, and it's just what I'm talking about with the cheerleaders out there. We see it. When this grabs a hold of us in a crowd, it goes right through us. Denmark has 36 cases now. Trinity has 32. There are 75 active staff cases. Like I said, the National Guard and DHHR and local health departments continue to do great stuff. Get your flu shot. We've now have out in the pipeline $208 million that are going to the cities and the counties. We want you to continue to apply, and we'll try as hard as in us to be able to have the dollars available to get them to you. Get your applications in, please. And we know that's tremendous backstop and help for our cities and counties, and we're really delighted to be able to do that. I encourage you about giving blood, especially if you have had this dreaded disease and you've recovered. The plasma or whatever, and giving your blood is so important. And, you could have antibodies and everything that could save a lot of lives. And so please consider giving blood. It's really, really, really important. We have a new aspect today called a Child Crisis Line. Help for West Virginia now offers a free 24/7 call, chat, and text line that provides immediate help for West Virginia children struggling with addiction or mental health issues. And they also operate a new child crisis line. And this helpline is available 24/7 to assist and in every way with youth behavioral issues and everything from parenting right on down. We all know that there's a lot of kids that fall through the cracks and they need help and everything. And right there it is. And if you're having a problem and you just want somebody to talk to, please call us. Please call us, and we'll try to help in every way we can. Our kids are so precious. They're so good. And for those of you that are out there that aren't with the kids, like I've been with the kids, you can't fathom the issues that today that they have to deal with. When I was growing up, probably when you were growing up, I know from my standpoint, we played kick the can in the alley. We played wiffle ball in the backyards. We really played tackle football in the front yards, and so many different things, that were just parts of our lives. But today, with all this social media and with all this craziness on TV that you can see and kids are exposed to, and the bullying and everything that's out there, it can make life really, really, really difficult. You've got all the drugs and everything that make life for these kids with parents that are really struggling from drug addiction to who knows what and everything, and these kids are really hurting. And plus, a lot of them are hungry. A lot of them just are plain hungry. And so, really and truly, if you're one of those kids and everything, and you can reach out to us, we'll really try to help. But always remember these children. They're our absolute precious ones. Today, tomorrow rather, we're going to have the funeral for Cassie Johnson. A beautiful lady, one of our Charleston police officers that responded to a call of just a parking complaint. It broke out into gunfire. and she was shot and fatally wounded. You know, our flags will be lowered tomorrow at the state capitol and in Kanawha County, and they will be lowered in her honor. And I have issued a proclamation today, you know, of the lowering of the flags today in celebrating her life as well, or the lowering of the flags on Tuesday celebrating her life. You know, to her loved ones in every way, I just, you know, when you're dealing with an invisible killer that's just wiping us out like crazy, that's one thing. But when you deal with something like this, so incredibly unnecessary, such bravery like nobody can ever imagine. These officers, first of all, ask yourself really just point blank, are they compensated enough? The answer is no way. Are they appreciated enough? The answer is not a chance on the planet. Take time. Take time to show them how much you love them, how much you appreciate them. And Cassie, you'll surely be in our prayers, and as well as all your loved ones. Also, in support of National Pearl Harbor Remembrance Day, in accordance with President Trump's proclamation, I have issued a proclamation ordering all flags to half-staff today, Monday the 7th, to honor 2,334 servicemen and servicewomen who died at that attack on Pearl Harbor. You know, there were more than 1,100, actually the number is 1,143, that absolutely were wounded at that time as well. You know, war can be some tough stuff, really tough stuff. You know, you think, you just go back and just think just for a second, how much do we owe these people? How much do we owe Cassie? How much do we owe them? We probably owe them everything in our lives. And yet we can come up with the craziest stuff known to man. Somebody comes up and says, defund the police. Are you out of your mind? Are you totally out of your mind? And yet they still come. They still come when you call. You know, Cassie, we're not going to forget you. That's all there is to it. And we're not going to forget all those that we lost at Pearl Harbor and all those that have dedicated their lives. Many, many have paid the ultimate sacrifice, but many, many are protecting us even as we speak today, our great military. So thank you to all of them, from the bottom of my heart for sure. And we did a little thing over at the mansion, and everything is, you know, a joyful night, and it will air tonight. I'm sorry, it will air tomorrow night at 7 p.m. And basically, Randall Reed Smith put the thing together, and it has to be done virtually this year. And it's the lighting of our Christmas tree out front and all the different things. And we tried to put it together as best we possibly could from a virtual standpoint. Kathy and myself, our First Lady and myself, we did a bunch of the stuff and everything. And Randall, you know, led the charge and everything. And what an incredible talent Randall is. And I thank him in every way. And so, you know, every year we have the Joyful Night celebration where Kathy and I light, you know, Kathy and I have had the opportunity to light while I've been here as your governor, had, you know, to light the state Christmas tree and hear performances from artists and from all over our state. You know, the Cabell Midland Band has been there along with other bands, and, you know, and you know, people from Capitol have been there. I don't know, just different schools that have done unbelievable stuff. And so, well, you know, if you could tune in, the celebration will be broadcast statewide on my website and social media, and it'll also be on the West Virginia channel for West Virginia Public Broadcasting at 7 p.m. tomorrow night. Last thing I've got again is our hunting and fishing promo that I've been pushing and everything for people to buy their license and buy it now, and they'll get entered into these great drawings and all the stuff that's going on there. And the other thing is, I say it over and over and over. There's no place in nature. There's no place like West Virginia. So getting out and just seeing what's out there and being able to enjoy all the incredible nature, from our mountains to our flatlands to being able to be on our streams and our waters, just, whether it be a smaller one of our lakes like Sherwood Lake. I mean, if you've not been to Sherwood Lake, you need to go. It is spectacular, and it's in Pocahontas County. It's just unbelievable, but there's just so many places like that to be able just to go and see, and it will touch your soul. But we got a lot of issues in West Virginia today, and a lot of issues in America. Keep your prayers going like crazy and stay the course. We're really, really close to this vaccine. I hope and pray we'll be through this and be through this faster than not. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good afternoon. I really just want to briefly touch on a couple of things the governor said. We are in this pandemic, and although we continue to try to project the future to the best level that we can, we should realize as a citizenry and as a state that this is a very dynamic process. And as the governor has projected, our goal is to vaccinate as many West Virginians as we possibly can, starting with the highest risk categories that would be consistent with the guidance that the Centers for Disease Control has issued, or our internal advisory group would suggest to us, and where the governor would feel comfortable. And as we trust that the vaccine distribution is going to pick up over time, then we know we'll be able to immunize more and more West Virginians. Two issues about that from my perspective. So number one, and I said this before, that when it is your turn to get vaccinated, or your family's turn to be vaccinated, and this vaccine group, the initial one we believe will be Pfizer vaccine, then the Moderna vaccine, and then probably the AstraZeneca vaccine, goes through the Federal Drug Administration approval process, then each West Virginian should feel comfortable that that vaccine is safe to take from the standpoint of the clinical trials that have been ongoing. This vaccine has moved very rapidly, and I think all of us know that. And the technology that's being used, at least for the Pfizer and for the Moderna vaccine, are decade old, but continuously have been improved to the point now where they are really going to advance our ability to move vaccines quickly, not just for COVID-19, but for vaccines that we'll need in the future. So these are really game-changing vaccines. Now, the United Kingdom has approved the Pfizer vaccine already, which is good news for us, because the United Kingdom used a continuous rolling information set to work with Pfizer to get their information in real time. The FDA is going through a bit of a different process, but they're doing it in a very rapid way. But the FDA, the Federal Drug Administration, which approves all the vaccines, knows what an important set of decisions this is. So next Thursday, this Thursday, Pfizer comes up for approval for the emergency use authorization. And because of the importance of this, the FDA is treating this like they would a normal approval process. So they're being very, very thorough. And that should reassure each West Virginian and each American. The vaccines are safe, as the governor said. The side effects appear to be local, maybe a little bit of arm pain, and some people after the second vaccine, and we need to have everybody get 2 vaccines with the Pfizer and the Moderna products. And the second vaccine can give people sometimes feeling a little like they have a cold or something, which is really short-lived. But the vaccines cannot give you COVID, cannot give you a cold. The side effects are really the body's responding to that immune system activation, which will protect people if you do get exposed to COVID-19. So people should feel safe doing that. And as we said before, there's no ability for these vaccines to implant some sort of device that reads people's thoughts or controls people. That is fantasy. These vaccines are safe, and each one of us on this call will be happy and feel very comfortable taking either of those vaccines or the AstraZeneca vaccine as it goes through the approval process for the FDA. The other thing that I just wanted to say is, as we project forward, we know that this is a very rapid and dynamic process. So for instance, Pfizer has had an issue that's being reported with the raw materials for some of the supply chain, which could impact how quickly Pfizer can get the amount of vaccine out immediately. But Pfizer is committed to make sure that everything is high quality, and their projection for vaccines in 2021 now is over 1 billion vaccines. So ultimately, we know that these distribution channels, the number of vaccines we have, is going to grow very rapidly from all these companies as they get through the approval process with the FDA. And we want each West Virginian to have that opportunity to be vaccinated. But when it's your turn, please get vaccinated. And until everybody's vaccinated, please, as the governor said, continue to wear your mask, to physically distance, and to make sure you're being really smart about this indoor season coming up. Because we know today more people in America, more people in West Virginia are being found to be positive on a daily basis. More people are in the hospital than ever before, and we're seeing death rates increase, as the governor said, in our state and in our country. So it is really important that today everybody commit to doing the things in our power to reduce the spread of COVID-19. Thank you.
All right, thank you, Dr. Marsh. Next to Major General Hoyer with the West Virginia National Guard.
Good afternoon. First, on behalf of all the men and women of the West Virginia National Guard, our families, we send out our thoughts and prayers to the family of Officer Cassie Johnson, our friends at the Charleston Police Department in the city of Charleston, and we will keep them all in our thoughts and prayers and continue to respect her great service to the city and our state. We continue to work significant support to test lanes, but we'll be continuing, as the governor pointed out, to start to pivot National Guard assets to work the vaccine distribution process, continue to work vaccine distribution planning through our interagency task force. They meet regularly. We continue to update the governor on our progress. And this week, we will also do some additional tabletop exercises and drills to begin to prepare for the route reconnaissance and the transportation process. Particularly want to thank work over the weekend from the West Virginia Healthcare Association, West Virginia Hospital Association, and the Board of Pharmacy in conjunction with DHHR and the National Guard on some significant planning efforts for the first phase rollout and those requirements that are out there. Last two things I would leave you with. One is the governor continues to press us each day to get better at what we're doing to address the pandemic and take care of citizens. Friday, we used the test that we developed through DHHR, the Guard, West Virginia University, the PCR test, to test residents at the Clarksburg Veterans Home, the West Virginia State Veterans Home. Due to the initiative that the governor put in place for regular testing of staff at facilities, we identified potential positives in staff. We then immediately used the test that we developed and turned that test within 8 hours to make sure that we were protecting the residents at that state veterans home. So I think it's a testament to what's going on, the effort he continues to press us to do, and wanted to make sure citizens were aware that we're continuing to take care of those most vulnerable, particularly our veterans. Last thing I'd leave you with, as the governor pointed out, today is Pearl Harbor Day. On that day in 1941, 2,403 American service members lost their lives at Pearl Harbor. From that led to our entry into World War II and the many sacrifices made not just by veterans, but by families across the United States, a whole of government and a whole of nation approach to defeating the threats that we faced in World War II. We're fighting a war today, and we need to all continue to step up like our ancestors did during that time period and do the things that we need to do. It just so happens that the war we're up against today is a virus and not a foreign enemy. But I ask us all to continue to press hard, listen to what the governor asks us to do, and move forward to defeat this virus. Thank you.
All right, thank you, General. Next to Secretary Bill Crouch with the West Virginia DHHR.
Good afternoon, everyone. I want to talk for a few minutes about the dashboard and the map. We've had several questions over the past week about the map again. I want to make sure we're clear. As everyone knows, we're tracking two different metrics on the map. And as I've said many times, the dashboard is more than just the map. So we have the infection rate, which is the probability of infection of COVID. And we have the positivity rate, which is positive tests over total tests. So it shows the percentage of individuals who are positive that are tested. It is critically important that the public be aware of both of these metrics. Several months ago, we changed the map to include the infection rate and the positivity rate for a week for each county. So that information is on the dashboard. It's very easy to look at the trend on the infection rate and very easy to look at the trend on positivity rate. There is additionally detailed information, and we're looking again to make further changes as we go forward. But there is a great deal of information on the map that can be used to look at risk in your communities and risk in your counties. One of the things we want to make sure that people understand is as the infection rate turns red, and we have a lot of red on the map, on the list right now of counties, that's an indication that individuals should be more diligent in wearing masks, more diligent in hand washing, and more diligent in their distancing of others. So this is a way to look at the map and know how your county is looking. When you have a county that is red or in infection rate, but green in positivity rate, there is a higher risk of infection. So please wear your mask anytime you're out of your home, anytime you're in other buildings following the governor's order. With that, again, if there are any questions, we're happy to take those up later, but I thank you all. Please look at the dashboard and the data there. As we enter the next phase of this, as the governor spoke to and Clay spoke to, we're going to be focusing on vaccines, but don't forget, we still cannot lose that focus on our mask and protecting ourselves and others. Thank you.
Thank you, Secretary. Finally, from Dr. Ayn Amjad, our State Health Officer.
Good afternoon. This week is National Influenza Vaccination Week, so I do want to take this time to remind everyone that you still have time to get your influenza vaccine. COVID-19 and the flu is spread by respiratory droplets, so this is a good time to still get your vaccine. Getting COVID-19 and the flu is not a good combination, so we do want to remind people to wash your hands, keep socially distanced, and to wear your mask when you do go out in the public. So you can still get your vaccine. You can call your family doctor. Health departments still have them as well. So do want to take that time. Vaccinefinder.org is also available if you need to find a place to get your vaccine. Thank you.
Thank you, Doctor. We'll now go to questions from members of the media. The first today is from Steve Adams with Ogden Newspapers.
Hello, Steve Adams with Ogden Newspapers here. I have a question. I've been getting some questions over the last few days in regards to inmates in regards to vaccinations. Now, I've read the draft plan, and I don't know if it's changed since you all released the draft plan in regards to vaccinations. I believe on the second part of phase one, correctional officers and staff are part of that second part of phase one when it comes to vaccinations as essential employees. But I have been asked whether there was a possibility that inmates would be added to that list, and would appreciate some kind of your thought process on why or why not that wouldn't be the case. I've heard it said that most of the cases, and you can confirm this for me one way or the other, that most of the cases in correctional facilities ultimately have been because of correctional officers bringing it in and infecting other inmates versus inmates coming in, because I know that there's protocols that our system takes in regards to intake for inmates into regional jails and correctional facilities. So if someone could answer those questions for me, I'd appreciate it. Thank you.
I think General Hoyer, you can start, and then maybe Bill Krause can jump in and add a little bit to that.
Okay. Yes, sir, Governor. So, Stephen, you are correct. We continue based on guidance as put out by CDC to continue to refine the process in the phases, with our initial focus, as you know, phase one on healthcare setting, the primary workers and the long-term care and assisted living facilities. You are correct that I believe Dr. Amjad could validate that epidemiology data shows that the bulk of the infections in our prisons are coming from correctional officers bringing the virus into the facilities. Correctional officers are part of the initial group with police officers, and we'll continue to look at the time sequence in the availability of vaccines and where prisoners will fall into that related to the group, looking at the overarching requirements to best mitigate the spread within the state of West Virginia.
Yeah, this is Bill. General Hoyer, that is letter perfect. I have nothing to add to that. Thank you.
All right, thank you, Stephen. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, both of my questions are vaccine related, but they're connected. So I want to ask either Dr. Marsh or Dr. Amjad, and even General Hoyer, whoever's best suited to answer which facet of the question. The first one is, while you're delineating, following the CDC guidelines about whom is to get the vaccines first, has there been any thought to specifically targeting, once you get healthcare workers and nursing home staff and residents, et cetera, classes like retail workers and teachers specifically, because they have to be on the job working, those who have comorbidity? If you could find, or if people would report that they have an underlying illness which would make them very high risk, would you be able to pluck those members out of those populations to get the vaccine first, along with those other groups you've already designated? Okay, that's the first question. And secondly, this is very technical, and I don't know if I understand it very much, but people have contacted me about aborted fetal tissues being used to create vaccines, and that's giving them pause as to whether or not they're going to take it. And what research I've done shows that yes, some of these vaccines, including Moderna, at one point did use aborted fetal tissue legacy lines. Some of these lines have been in place for as long as 50 years, and they've been used for research. So if Dr. Marsh or Dr. Amjad could get into that and say, well, technically the origination was fetal tissue, explain how it's really just legacy cells now and not actually something from an aborted fetus, say in the past month or year or something like that. I know that's very technical. I apologize for the length of the questions and asking two of them at the same time. Thank you.
General, you and Clay are going to have to answer the first one. Clay, you're going to have to answer the second one.
Okay, Clay. So Kenny, to your first question, yes, we are, as the group that makes the recommendations to the governor, we are looking at those comorbid disease issues and the various classes of groups to process people through more quickly to better address, mitigate spread, and better protect the most vulnerable citizens of the state. And I'll turn the rest of it over to Dr. Marsh and Dr. Amjad.
Thank you, General, and thank you, Kenny. So the information you're alluding to is really is an important one. You know, the Moderna vaccine and the Pfizer vaccine are made with a recombinant sequence of nucleic acids of genetic material that's man-made, you know, manufactured synthetically, that then instructs our cells to make that spike protein, the part of the virus. If the virus is like a sun and the center is the body of the virus, the spike proteins are like the lines, the corona that go out from that. And the vaccine is really instructing the body to make that part of the virus that is the spike protein, that sort of straight line that we would draw as kids from the sun, so that the vaccine does not involve a whole virus, so it can't infect you, it can't cause COVID. It is broken down quickly. So these vaccines, like I say, are really game changers. They will change the way that we vaccinate many, many things in the future. When it comes to working on cell lines are oftentimes used, and I can't say exactly about the question about fetal tissue, but I can look that up. But from cancers, or sometimes from very, very early stage cells, because those cells can live for a long time. And they are oftentimes used in the laboratory as cell lines. But as you say, as to my knowledge, there's been no embryos or aborted fetuses or anything like that that has been used in any kind of contemporary manner. In other words, no, recent fetuses or anything like that. And if any cells have been used that has anything to do with that, these are cells that have been used in laboratory settings for many, 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 many years. And they've become sort of some of the tools of the trade for many people that work in research laboratories. But Kenny, I will look that up, and I'll have a more specific answer for you on the Wednesday brief.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. I was hoping someone could address where do our state lawmakers and the members of their staff fall in the vaccine plan? And do we think we'll be able to get all of those folks vaccinated before, the beginning of February, so that we could have a relatively normal session? Thank you.
Clay, maybe you take a stab at it. Government, we've got to find a way to keep, the institutions that we have. We've got to keep running. I mean, at the end of the day, one of the biggest things we've got to do is look at, keeping the frontline medical community, taken care of, because they run the hospitals and they keep it moving and everything. But Clay, maybe you could answer it better than anybody. Well,
thank you, Governor. I think that the answer that you've provided is correct. The governor has instructed us, and General Hoyer and Secretary Crouch and Commissioner Amjad and our team, to do two things, really. Number one is to make sure that we maintain both the capacity and the vital functions of our healthcare enterprise, and also our critical workers that continue to keep the state moving and to allow us at the leadership level to continue to make progress, which would include certainly the legislative component of government, the executive branch of government, the judicial branch of government, but also to save lives. And so as we're trying to balance both of those, the question about focusing on more susceptible people as part of our first approach in some of these critical areas of first responder, healthcare personnel, particularly outpatient now, as we look at, teachers and look at other critical industry sectors, and then looking at government, then we certainly understand the need in fulfilling the governor's two requirements to us of very closely looking at these groups and understanding how best to vaccinate the critical members of the groups and then the entirety of those groups as vaccine continues to come in, so that we can maintain that vital capacity, infrastructure, and progress, as well as save lives. Because as we've pointed out before, about half of our deaths in West Virginia and in the United States are from the most vulnerable, oldest, sickest people, oftentimes that live and reside in nursing homes and long-term care facilities. Thank you.
All right, thank you, Charles. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members and fellow reporters. I want to kind of follow up on my friend Kenny Bass's question and ask it a little bit differently in terms of how you prioritize things. And I want to drill down into the vaccinations. So if you receive 16,000 vaccinations this coming Friday, that's enough for 8,000 people if that counts the 2 doses. How do you prioritize which nursing homes to go to first? Do you go to the ones that have the most recent outbreaks? Do you go to the ones that have had the most cases? Or do you go with the ones that maybe have the most at-risk people with all the comorbidities? So I guess I'm trying to figure out how you prioritize, because 8,000 doses isn't go very far.
Okay, let me jump in. Let me say this. I need to clarify this. Mark, it's not 16,000 doses, and therefore you have 8. You got to keep back 8 and everything, because you've got to go in another 21 days with the 8 that you already vaccinated. It doesn't work that way. It's 16,000 and change doses, and this is coming from Pfizer. Moderna will jump right back in, and we hope in the next week with their 3,000 to 5,000, it'll come in on in the initial the initial time period. But what will happen, Mark, is this: we'll vaccinate 16,000 people, okay, and those not 8, but 16,000 and change those people. The government guarantees us that on that 21-day anniversary, there'll be 16,000 more come in that we'll be able to handle the 16,000 that we did the first go round. And that's the way that works. In the same way with Moderna. But in addition to that, we will have the increase coming in every week. So with all that being said, that's a little bit in error. I think our health community or states across this country, all the different states, working with the White House, working with all the people, that are out there, are coming up with plans to best be able to utilize what vaccinations we have. And first and foremost, we need to take care of the acute care, and then we need to take care of, our first responders and all those people. And then we need to be taking care of the people that are in our nursing homes, the most vulnerable people. But along the way, we've got to take care of our police and our leadership and all that as well. But I think, maybe Dr. Marsh, our health community is driving all that. But Dr. Marsh, if you could, or maybe General Hoyer, you could add. Maybe you could handle this better than anybody.
Clay, you want me to start?
You start.
So, Mark, as the governor pointed out, 16,000 doses is 16,000 doses. It's not divided by 2 for the second shot. The federal government has a good plan in place to give us the second booster in the case of the Pfizer vaccine in 21 days, Moderna 28. We have been working as a group, making recommendations to the governor, and we believe that based on the allocations that we'll get and the sequence that we understand coming from Operation Warp Speed and CDC, that we will be able to quickly dispatch the requirements that the governor pointed out, those acute care requirements, keep hospitals and key medical activities going, as well as taking care of our vulnerable population in our nursing homes and assisted living facilities, as well as the staff, because we know they tend to bring the virus into the facility. And we think within a very short period of time of possibly 3 to 4 weeks, we would be able to cover down on that entire population as we work to the others going forward.
Okay. All right. Let me say something that I saw this morning on one of the early news channels. They were talking about this, and I want everybody to dial in as best you possibly can right now. You know, they were talking about how we administer CARES money. You know, and you know what one of the biggest concerns of all was? And it was just this. And when the CARES money goes out to the cities and the counties or the county commissions or whatever, you may very well have a Democrat governor or Republican governor, you know, and they may decide arbitrarily that we're going to slant this and we're really only going to really protect the Republican city mayors or the Republicans, you know, that are on the county commissions or predominantly the county commissions there, and we're going to let the others just fend for themselves as best we can. Maybe we'll throw them a cracker every now and then, but for the most part, we're going to do this right down party lines. I couldn't believe it. I couldn't believe it. But the one thing you can count on, and you can count on by me, I have said it 1,000 times over. This should have nothing to do with politics. It should have everything to do with need. And absolutely, with all in me, every single thing, from how we distribute the vaccines to how we distribute all the CARES money to the cities and the counties and everything, you find a pet project. You find one. You find some pet project that's been put into place and everything here because Jim Justice wanted to do that for the party, or Jim Justice wanted to do that for Jim Justice. You find one. You're not going to find them. Now, I want to be fair. I want to be fair to everybody. I don't want to discriminate from people that, you know, that have projects that know me or whatever like that. I don't want to do that. But you find one where we have absolutely done anything to absolutely pad ourselves. No way. No way. You can quit these silly questions. No way.
All right, thank you, Mark. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. I have a question about nursing home staffing. During the pandemic, of course, many nursing homes have been affected by the virus getting into the nursing home, and that has exposed a lot of the patients and, of course, a lot of the staff. And I'm getting reports that a lot of the staff have been doubling up on duties, and sometimes the staffing at the nursing home is not what it should be. Are you monitoring the staffing of nursing homes during the pandemic, and how are they holding up?
Dr. Amjad, you know, maybe you can take this, please.
Sure, Paul. We do that, Paul. We actually speak with our nursing home association once a week. We were doing that prior to even the vaccination rollout, but we have a really good relationship with our nursing home association, so we keep up with their staffing ratios and keep an eye on that. So we have been doing that. You're right. They are working very hard and they are pulling double duties a lot of times, but we do have a lot of conversation with them, and they do have large outbreaks there, but we do keep an eye on all those numbers as well, just like we do with the hospital association. Thank you.
All right, thank you, Paul. Next to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. Hi, panel. Dave Mistich, West Virginia Public Broadcasting. My question relates to some comments that we heard from, top officials from the White House Coronavirus Task Force over the weekend. Dr. Deborah Birx has said, warning people to not go to indoor gatherings around the holidays, to continue to wear a mask. I also heard that Dr. Anthony Fauci, as well as Dr. Birx, have called on governors and local officials to implement more restrictive measures to mitigate the spread of the virus, if they haven't already done so in recent weeks. My question is, do you remain in contact with the top officials in place now? Are you in contact with the incoming Biden administration and their picks as this moves along? And given the increase that we saw over the weekend, are we looking to implement more measures? And a question sort of off to the side of that, I think, is for Dr. Marsh. Have we seen all that we've expected to see as far as an uptick from the Thanksgiving holiday? And if not, how long can we expect before we see that peak? Thank you.
Well, Dave, first of all, I am absolutely staying in close contact, with all the people that you spoke of. You can get a mixed bag coming from anywhere. I do hear caution, from everybody, from even the president all the way down. The president, surely is not an advocate of shutting things down. I think from the standpoint of the way the way Dr. Birx or Dr. Fauci or whatever are looking at things, you're looking at states with a positivity percentage that's maybe multiple times what ours is, and so there's so many different variations of what we're discussing here. But as far as staying in contact with them and getting constant feedback from them, absolutely. I am sure that our people will begin discussion, and we will welcome that discussion immediately with all the Biden people as well. And but Dave, from a standpoint of also us watching things and watching them real closely, I mean, we ran to ground just the other day. What can we identify that's coming from our bars, or what can we identify that's coming from a specific place? And you really can't. You can't identify any significant issue that's coming from any significant branch of this. It is coming from all kinds of different areas. And Dave, you've got to just think this way. I mean, and that's all there is to it. If you cannot identify something that will make a significant difference, then you've got to think about these people. I mean, just think. If you close something and lay off a bunch of people, yeah. I mean, if I had any kind of evidence that it would genuinely really help the situation, I mean, you've seen what I've done in the past. I haven't hesitated one bit. I mean, I'd pull the trigger and shut it down immediately if I knew what was really going to make a real difference, short of a wholesale shutdown all across our land, which I think would be devastating beyond belief. Now, but if you can't identify something that's going to really make a difference, then you've got to think just about this. All these people, if you're kind of shooting in the dark a little bit, and you can't identify without any question, this is going to make a real difference, and absolutely it's going to make a real difference, and you shut down all indoor dining in 10 counties, what's going to be the impact of that? Just think of all the everything that is supplied to those restaurants. Not only just the restaurants workers, but you think about how many people that can be materially affected by that. Now, and if that be the case, just think about those families that are sitting at home and they don't know where to turn. They got to pay their power bill. They got to buy food. They got to maybe buy presents for their kids. This is the time of year maybe that the retail places are going to either make it or not make it. There are so many repercussions. Who's going to reach out to drugs or the possibility of, God forbid, a suicide or whatever it may be? For crying out loud, Dave, it is really, really tough stuff. And from the standpoint of, if people can bring me things that say, this is a real problem, Governor, act right now. But we can't do that right now because it's coming in too many different directions. But nevertheless, you know, I can tell you that we were on the phone just, I can't recall, you know, probably Thursday of last week. We were on a call with the vice president. Dr. Fauci was right there. And actually he wasn't there, he was zoomed in. But Dr. Fauci gave a complete presentation, and the Biden people have just hired him. I mean, so I feel sure that Dr. Fauci will be on their team, and he's supplying information, and we're communicating back and forth. There's lots and lots of communications that are going on, but that's about all I got.
All right, thank you, Dave. Next to Kelsey Soto with WSAZ.
Kelsey Soto with WSAZ. Governor, I think 27 of 55 counties are going to school virtually right now. Some have been doing that for about a month, if not longer. I know you keep talking about not wanting to close more things down. So why are schools the one area that we're seeing additional closures, prolonged closures, and weekly more and more added?
Well, Kelsey, you know, I think, you know, that question is more tailored for the Department of Ed. I think the Department of Ed and any of us are not, we would all be not telling you the truth if we told you that the virtual learning is a slam dunk, great, really working great. It's not. It's just not. In fact, it's working very much less than what we had hoped, even though we have great people that are trying in every way, and we did all kinds of stuff to make the points, you know, to where the kids could get their lessons plans easier, and we put up 1,000 plus, you know, things that made things easier and better. We've done a lot of stuff to make it work and work better, but the bottom line of the whole thing is, if these kids aren't in school, if they aren't in school, they're going to really suffer. And they're going to have a void. That's all there is to it. Our teachers have done fantastic. Our service personnel have done fantastic. The schools, by the numbers that I read and everything, are safe. You have some knee-jerk reaction that goes on and everything, but sometimes that knee-jerk reaction is the right reaction too. You know, that's why we've left it to the counties to make their decisions. And so hopefully we can keep as many counties and those kids in schools as we possibly can.
All right, thank you, Kelsey. Next to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. I wanted to follow up on a statement by Secretary Crouch saying that residents of each county need to look at both the daily positivity and the infection rate in their counties. If you go by infection rate today, 54 or 55 counties are red. If you go by the lower of the two, as the governor said, about 40% of counties are showing green, yellow, or gold. Given that there's a certain population in the state that are not inclined to take this virus seriously, are we creating a false sense of security using the map that with the either or that makes a number of counties look like they're safe at the moment?
Let me try this before we go, you know, with Secretary Crouch. But, you know, Phil, and I try to never ask a question back, but you're exactly right. You're exactly right. That today, if we just took purely the infection rate, purely the rate that came out with the Harvard map, I think, we would have 54 of our 55 counties, I think, that would drift possibly into the red, or a tremendous amount of them, almost all of them. So maybe I'll ask the question to myself so I can keep going, but would you, if you were in charge of the whole state, just shut the entire state down? Close all of our businesses? Close all of our schools? Is that what Phil Kabler would suggest to do? I mean, and if that be the case, would you be willing to be able to handle all the ramifications of everything that happened? All the medical teams saying it would be chaos, all the economic teams saying it'd be chaos, all the public education teams saying it'd be devastating to our kids beyond belief. Would that be the right answer? I can't imagine. I can't imagine that anywhere in the land that is running rampant beyond belief above West Virginia, would it be the right thing to say that tomorrow in the state of Florida, in the state of Kentucky, in the state of Ohio, we're going to close the whole state? And if that's what you're suggesting, you know, I would love for you to report that. I would love for you to have the headlines that says, Kabler supports closing the entire state of West Virginia down. Now think about it. Think about just how silly that is. You know, at some point in time, it could very well get to that. God forbid that we ever could get to that. From the standpoint of is it having people relax because some of the counties are green and some of the counties are gold and some of the counties are yellow and everything else like that? I mean, Phil, we're here every day. People see people dying all over the place. Everybody sees what we see, and for the most part, West Virginians are doing a heck of a good job. Tomorrow, go out and go in any store, any place, anytime, in any store, and what you'll see for the most part is West Virginians are doing a really good job. Now, can we do better? Of course we can do better, and we're trying to get the 3% or the way out or whatever it may be, we're trying to get them on board. But go look in any store, and you're going to see for the most part, West Virginians are doing a heck of a good job. And for the most part, our numbers, as I read to you just earlier, West Virginia at 799 on last Friday, Kentucky at 2,000, Maryland at almost 5,000, Ohio at almost 7,000, Pennsylvania at 11,000, and Virginia at 4,000. We're doing it. We're doing, pretty dadgum good. And so with all that being said, you're right. You're right, Phil. If you just went by one metric, would Phil Kabler come out and tomorrow be the headlines of the Charleston Gazette? Kabler says shut entire state down. Are you kidding me? Are you really kidding me? Well, right under it, you ought to write, justice says no. But the bottom line of the whole thing to me is just this. We've got to all continue to watch, all continue to do every single thing we're doing. And these great people that I listen to every day are doing just that.
All right, thanks, Phil. Last question today from Matthew Young with the West Virginia Daily News.
Hi, good afternoon. Matthew Young with the West Virginia Daily News. I was curious about Pocahontas County. They have been in the orange for, I believe, 3 weeks now. But aside from Walgreens, they don't have any of the free testing locations or events scheduled. Obviously, they're a smaller county. I believe they're under 9,000 residents. But even still, they're still only averaging somewhere in the neighborhood of 45 to 50 tests per day. Is it because Pocahontas is such a small county that none of the free testing events are scheduled there, or is it more a matter of there just aren't enough resources to be everywhere we would like to be? Thank you.
I think the answer, and General Hoyer and Dr. Amjad, maybe you can jump in and just answer it. But I think the bottom line is we're still willing and able to go, or we're trying to go as best we possibly can to all the places. from the standpoint of them being a smaller county, we try to run to fires. I mean, that's what we're going to do and everything. From the standpoint of people not coming out and getting tested, yeah, that's really a possibility. But General Hoyer, maybe you and Dr. Armstrong could end this up.
Yeah, Matthew, we'll get with DHHR Health Command. We'll look at the number of testing events that have been occurring in the various counties in and around Pocahontas County and get information back to you. I don't have that specific data in front of me right now, but I will have our public affairs officer get information back to you. I believe there should have been more than just the Walgreens testing available, but we'll get that to you.
All right, thank you, Matthew. Governor, I'll turn it back to you.
Okay, a lot of good questions, and I appreciate that. And you know, from the standpoint, again, you know, I mentioned Sherwood Lake and Pocahontas County, and I spent a lot of time in Pocahontas County years and years ago because it was a great place to go hunt and fish, and beautiful county beyond belief, and you know, sparse and everything, but at the same time, its beauty is untouched, and we want to surely take care of the people there in every way. And you heard the General's answer, and I'm sure he'll be on top of that. Now, the only other thing I would add to that is just this: as we move towards you know, vaccinating, you know, we're going to have to take a whole lot more of this load of testing back on the shoulders of DHHR, and so we'll get it done, and the Guard will still be there and everything. But at the same time, the Guard is going to have to administer this, you know, our vaccine. So you know, everybody's stretched to the limit, but that's just how it is. And so what? You know, I'm not going to sit here and tell you how hard we're working, because my dad used to always say, and you've heard me say it before, son, if you can't get it done in 24 hours a day, you got to work nights. And right now here, everybody's working nights, and so what? You know, he would also say, don't ever accuse or confuse effort with accomplishment. We just don't want to try hard. We want to get it done. And that's what everybody here, the way everybody here is working and everything going forward. You know, there are questions in lots of different ways of what we should do, you know, as far as testing the legislature and testing this and everything. You know, I am hopeful beyond belief that if the question arose tomorrow, you know, get the legislature tested, have as close to normal, you know, a session as we can possibly have when we come back into session and everything, and get as much done as we possibly can. The bottom line is, if we said tomorrow we're going to test everybody in the legislature, would we have people opt out and say, no, I'm not going to take the vaccine? And you know, and how much of that would we have? And so we need to get vaccinated. We need to keep government moving. We need to do everything we possibly can to protect our people and to protect those that are helping to protect our people. And so, with all that being said, you know, I'll close by again bringing up just this. You know, I was dancing back and forth and trying to look at your notes and trying to think about it and everything. You know, our flags are going to be lowered today, you know, in remembrance and celebration of Pearl Harbor. And at the same time, Cassie's funeral is tomorrow. And our flags will be lowered again in remembrance and respect for her and her family and the service and all that she gave. Please take note of that. You know, it's bad enough when those flags come down halfway, but it's really bad when they start coming down for multiple days or multiple issues. So please remember all those that gave everything at Pearl Harbor so that we're right here, right now. And a beautiful young lady that gave everything for us right in our own community. Remember them. Remember all those we lost. I read 42 names today. Remember them all. God bless you. Thank you so much.